So the next presentation we're going to cover is nutrition. And the reason for including this is that patients often ask us if there's any foods that they shouldn't eat that may help with their symptoms, or any foods that they should eat to help with their symptoms. And although there are recent advances in research into the gut health and disease, there are no answers as yet. So we can't direct you on what you should and shouldn't eat, but I think there are resources available that we can share with you that will help you to explore what may or may not make a difference for you. So first of all, there's something called the FODMAP diet. So I don't want you to take this to the letter, but what I'd like you to do is use this as a strategy to explore food and what food may be helpful to you, or foods that may not be so helpful for your symptoms. So for example, people may say that tomatoes definitely make a difference to their symptoms. They always make their symptoms worse. Well, of course, it would be sensible to trial not eating tomatoes. So if there's particular foods that you find do make a difference to you, that's okay for you to do that. If there's any particular food groups, such as dairy, for example, that you feel are making a difference to your diet, it's important to discuss that with your GP to make sure that you're getting the correct nutrition, for example, the amount of calcium in your diet. So let's have a look at the video.
Did your provider suggest trying the low FODMAP diet? If so, you've probably been having digestive problems like functional abdominal pain or irritable bowel syndrome. Let's start by talking about what those are. Then we will talk about FODMAPs and how the diet might help. Functional abdominal pain and irritable bowel syndrome are types of belly discomfort and distress. They are thought to be persistent and associated with eating certain foods, recovering from stomach bugs, mental stress, or having extra sensitive intestines, or even a combination. If you are having pain on its own, it's called functional abdominal pain. If there's constipation or diarrhea too, it is called irritable bowel syndrome. The low FODMAP diet is a tool to narrow down which foods might be causing problems or making them worse. The word FODMAP is an acronym for the common culprits that cause bloating. The F in FODMAP stands for fermentable, or foods that make gas when they are digested. O, D, M, and P stand for different shapes of sugars: oligo, di, monosaccharides, and polyols. In addition to gas, poorly absorbed FODMAPs can pull extra water into the intestines and cause diarrhea.
So which foods are the ones high in FODMAPs?
There are 7 main categories. Your providers will give you a list. The first 4 are beans, alliums, cruciferous vegetables, and breads. These are the foods with the O in FODMAP, oligosaccharides. On the internet, you might read the names galactans and fructans. Galactans are carbohydrate sugars found in beans, peas, and lentils. Fructans are found in alliums and cruciferous vegetables. Alliums are the onions and garlics. Fructan sugars are also found in wheat, barley, and rye. These are the same grains that have gluten protein, but this diet is different from being gluten-free. Gluten is the protein in wheat. Fructan is the carbohydrate. This is good to know because foods labeled gluten-free might still be high in FODMAPs. The next categories are dairy and fruit sugars. These are the foods with the di and monosaccharides, D and M, lactose and fructose. Lactose is milk sugar, which is especially high in milk or ice cream. Fructose is fruit sugar. It is especially high in certain fruits like watermelon and apples. It is also what high fructose corn syrup is made of. The last group is the stone fruits, like peaches and avocados. These have polyols, or sugar alcohols like sorbitol or xylitol. The last letter P in FODMAP. These polyols are also used as the artificial sweeteners in sugar-free gum and mints. Remember, the low FODMAP diet is just a tool to help figure out which foods might be causing trouble in an organized way. It's not a permanent diet. The first step is to cut out the foods high in FODMAPs for 2 to 6 weeks. Most foods are still fine to eat. After a few weeks being FODMAP-free, the next step is called the re-challenge phase. Start adding foods back into your diet one by one while you watch for problems. Ideally, a dietitian will help you. From start to finish, the low FODMAP diet typically takes a few months to complete. At the end, you will know which specific foods you need to avoid to feel well. About half of adults who work through the low FODMAP diet find adjustments that make them feel better. It is also commonly used to help children. Also remember, functional abdominal pain and irritable bowel syndrome have many factors that contribute differently depending on the person. Your provider might recommend other tools in addition to the diet to help. So that's it. Let's recap. FODMAPs are foods that might cause bloating and discomfort. Adjusting your diet after going FODMAP-free for a short time can help functional abdominal pain and irritable bowel syndrome. It is one tool out of many your doctor may recommend to help you feel better. Thanks for watching.
So although the FODMAP diet isn't the complete answer, what it does do is it explains very well about how you can go about stopping certain food groups and introducing them to be able to work out whether there are particular foods that make a difference to your diet and your symptoms. But as I said before, I think if you are experiencing bowel symptoms which you haven't discussed with your GP, you should do that. And if there's particular problems with food groups that you're experiencing, it's also important to discuss that with your GP. It may be that you do need to be referred to a dietitian or nutritionist. So we're going to talk a little bit about glucose, because I think there is a little bit of evidence in fibromyalgia about glucose and glucose levels, and maybe we should be looking at trying to reduce that. And I think many of us often eat too much sugar anyway, and that it's a food that we should be looking at trying to reduce. So glucose in our blood comes from foods we eat, and these foods include those containing sugar and starchy foods that are broken down. And that sugar and starch are known as carbohydrates. So to keep our blood glucose level normal, our body uses a hormone, insulin. So as I said, there's some evidence about the link between pain in fibromyalgia and metabolic health and insulin resistance. And it's when the metabolism struggles to deal with the sugar. So again, although we haven't got the answers at the moment, with that bit of evidence, it's worth you exploring how much sugar and how much starchy foods that you do eat and seeing whether reducing that intake makes a difference. So looking at reducing the starchy carbs a lot, so that's not just the concentrated sugar, that's not just the obvious white stuff like bread, pasta and rice. It can be in other foods as well. But the obvious foods to try and cut out and reduce your intake of sweets, cakes, biscuits, that sort of thing. And if you are eating those foods, they do typically make you crave those foods more, make you hungrier. One of the other things to consider is actually the sweeteners. They can trick you. So although you may have changed from taking or eating or drinking sugar in drinks and change that to sweeteners, they can tease your brain and actually trick you into being hungrier. So it does seem to have an impact on weight gain and weight loss if you're having a lot of those sweeteners in drinks and foods. And one thing we often forget is alcohol is full of carbohydrates. Although we shouldn't be drinking too much alcohol anyway, it's all important to remember that the alcohol does contain carbohydrates, which is therefore sugar. So this is really what we can give you as the best guide at the moment, is looking at ideal foods that you should eat, looking at foods that you should enjoy in limited quantities, and then looking at foods that are best avoided. And those best avoided foods are the sugar, the starchy foods, the margarine oils high in omega-6, the beer, and certain fruits, because certain fruits, although we feel they're healthy, they can contain a lot of fructose. And ideally, if we're not taking on processed foods as well, that gives you a better all-round diet. So I think if you can look at what your current diet is, you can do a food diary and actually see what you are eating. Say, explore really what foods may or may not make a difference to you. But I think if we can all try and have a healthier diet, that's the first step.